Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Nigeria takes delivery of about 1.2 million doses of Johnson & Johnson COVID-19 vaccines. Edo State government warns against partial vaccination, takes campaign to mosques. And daily COVID-19 cases fall in Sydney, Australia for a third straight day as lockdown enters 11th week. And Nigeria's president has approved the appointment of Dr. Ifedayo Adetifa as the new Director General of the Nigeria Center for Disease Control, NCDC. Senior Special Assistant to the President on Media and Publicity, Mr. Garba Shehu, disclosed this yesterday. Dr. Adetifa replaces the NCDC chief, Chikwe Hekwazu, who recently got a job as the Assistant Director General of Health Emergency Intelligence at the WHO. Meanwhile, President Buhari also approved the setting up of a Health Sector Reform Committee to commence the development and implementation of a health sector reform program for Nigeria in collaboration with state governments and the FCT administration. In the meantime, last night's report, 379 cases were reported from across the country. Here's more on the coronavirus update.
The latest data from the Nigeria Center for Disease Control shows that the daily COVID-19 infections in the last 24 hours are 379 amid the spread of the Delta variant in the country. The latest figures were reported from 17 states and the FCT, indicating a drop from the figures reported earlier. Lagos recorded the highest tally of 138. 44 cases were recorded in Rivers. 26 cases were recorded in the FCT. Ekiti had 23. Oyo 22. Akwa Ibom 18. While Adamawa and Delta States reported 17 cases each. Anambra recorded 15 cases. Edo had 14. Ogun 13. Bayelsa 8. Niger had 7 cases, while 6 cases were registered in Kwara. Other states include Gombe with 5 cases, Plateau recorded 4 cases, while Kaduna and Kano recorded 1 case each. There were 0 cases reported from Nasarawa, Ondo, Osun, and Sokoto states. Nigeria now has a total of 195,890 confirmed cases. 353 people have been discharged in the last 24 hours, increasing the total number of recoveries to 184,882. 4 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,556. Presently, there are more than 8,000 active cases in Nigeria, while over 2.8 million samples have been tested so far. Over 986,000 eligible Nigerians have been vaccinated with the first dose of the Moderna vaccine, while over 142,000 eligible Nigerians vaccinated with the first dose have received the second dose of the AstraZeneca vaccine. In Africa, there are more than 7.9 million confirmed cases and over 200,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 221 million, while more than 4.5 million deaths have been reported.
Nigeria has received about 1.2 million doses of the Johnson & Johnson COVID-19 vaccine through the AVAD platform, coordinated by the African Union. These vaccines, according to the Executive Director of the National Primary Healthcare Development Agency, arrived the country Saturday, the 6th of September. Now, Dr. Faisal Shoaib also adds that the Phase 2 COVID-19 vaccination with Moderna and AstraZeneca has commenced fully in all the states of the Federation, including the Federal Capital Territory.
We also received 1,123,200 doses of the Johnson & Johnson COVID-19 vaccine late evening on Saturday, the 4th of September 2021, through the AVAT platform coordinated by the African Union Commission as part of the 39,800,000 doses procured by the federal government of Nigeria. The NAFDAC team have already taken samples for analysis and are currently scanning the codes to ensure proper serialization of the vaccine. As of 6 September 2021, A total of 3,600,858 eligible Nigerians have so far received their first dose of the COVID-19 vaccine. This is made up of 2,551,738 persons vaccinated with the AstraZeneca vaccine and 1,049,120 persons vaccinated with the Moderna vaccine. Therefore, 1,576,011 persons have been fully vaccinated with the AstraZeneca vaccine. We have now restarted the administration of AstraZeneca as first dose in all designated health facilities.
Meanwhile, Edo State has recorded 4 deaths in the last 24 hours. 3 were not vaccinated and the 4th was partially vaccinated. The permanent secretary of the state's Ministry of Health said this, underscoring the importance of the vaccination rollout. The team also took its vaccination campaign to mosques in the state.
Authorities in Edo State are concerned about the apparent apathy to vaccines in the state.
The vaccines are very much around with us.
In this conference, the COVID-19 response team lead gives an update of the COVID-19 figures in the state, while the permanent secretary, Ministry of Health, warns against partial vaccination.
Over the weekend, starting from Friday, Saturday, Sunday, we collected a total of 1,273 samples. We picked 148 cases. There were 4 recoveries and there were 4 deaths. So what that means is that from Friday to today, to this morning, we have had 8 deaths ascribed secondary to COVID.
What we have observed in the state is that some persons took their first jab or first shot of the vaccine and they are declining to come for the second one. And this actually speaks volume because we have seen a case of somebody who had the first dose and who has not taken the second dose, still coming down down the way we have been seeing those who did not get vaccinated at all. So we are appealing to all who had their first dose of the vaccine to please provide themselves or avail themselves of the opportunity to have the second shot.
As part of its determination to achieve at least 60% vaccination in the state, the COVID-19 response team is visiting mosques in Benin City. The chief imam appreciates the government making vaccines available to his congregation and urges residents to get vaccinated for full protection.
And I want to encourage all Edo people. The government means well for every one of us. He wants us to live well and be safe. That is why he's telling us that we should go and take our vaccine. When you take it, it will help to build up your immunity system. And you will live long. It's just like every other vaccine we used to take those when we were small, like the yellow fever, the measles, and the rest of them.
The government hopes that with deliberate enlightenment programs like these, the state will get to and exceed the 60% vaccination target.
And today is World Field Epidemiology Day, a global movement to recognize and raise awareness of the vital role of field epidemiologists in protecting the health of populations and advancing global health security. The past year has brought unprecedented visibility to the work of field epidemiologists as the world has fought COVID-19, but this visibility has not always resulted in understanding the importance of the field, nor in the increased support needed to strengthen public health systems around the globe to better detect and respond to outbreaks. In Nigeria, over 500 public health workers have been trained in epidemiology. This is through the Nigeria Field Epidemiology Training Program. Well, joining us for more on this special day is Dr. Jafiya Abubakar, Deputy Director and Head Epidemiology Division with the Nigeria Center for Disease Control. He joins us virtually from Abuja. Thank you for joining us on the program.
Thank you, Millicent. I'm happy to be here.
Now, the past year has brought more visibility to the work of field epidemiologists as the world continues to battle the pandemic. How has this field, epidemiology, how has it shaped the coronavirus pandemic, especially in Nigeria?
Yeah, so essentially epidemiology, is there to support the fight against any disease. It is the study of how disease spread and why they spread. And for COVID-19, we have supported the response in many areas. As you are aware, it is very important that we detect cases of COVID early. So field epidemiology has helped us to do that. It has helped us to identify and monitor the contacts of these cases so that we can also bring them early to care if there happen to be cases. Field epidemiology ensures that we regularly analyze our data to provide us with scientific information that will guide our decisions and policies. It has also made available skilled human resources to support our response efforts. Field epidemiologists also support in diagnostic capacity, including the use of RDTs. They have supported in points of entry surveillance, and even the public health and social measures that we have in place. This was informed based on the contributions and scientific evidence that has been provided by field epidemiology. So these are a few amongst so many things field epidemiology has done to support COVID-19 response within Nigeria and globally.
Dr. Abubakar, I mean, what has the experience been from the Ebola outbreak in 2014 to the impact of COVID? I mean, and this is despite the current healthcare system some have described as weak. Are we where we need to be?
Yeah, we are not where we need to be, really. However, it is important to say that we have made tremendous, progress. I will take you back in 2017. Nigeria conducted her first joint external evaluation to assess her preparedness in terms of, detection, prevention, detection, and response. At that time, Nigeria scored 39%. However, 2 years later, in 2019, Nigeria again conducted a midterm joint external evaluation, and we moved up to 7 places, up to 46%. It's not easy. It's a gradual thing. And I'm also happy to inform you that as we are talking now, Nigeria, through the National Center for Disease Control, have deployed digital surveillance tools across all the 774 LGAs in Nigeria. We have also established public health emergency operation centers, which serve as coordination hubs, which serve as centers where preparedness and response efforts to outbreaks, are done. Across all the 36 states and FCT, we have those, public health emergency operation centers. Also, currently we have over 110 PCR laboratories spread across all the 36 states and the FCT. So these are some of the achievements that we have done, through the period, starting right from the Ebola outbreak to where we are today during the COVID response. We are not yet where we are. There are still some challenges. I mean, investments and funding in global health security, can be improved. Human resource capacity gaps can also be addressed. We need to pre-position medicines, supplies, and additional, vaccines. All those areas, requires, additional investments.
So hopefully epidemiology will help us understand our options going forward. Finally, in a few seconds, if you can, how do you expect Nigeria can build back better? And this is from the COVID-19 response to strengthen our capacity also to preventing, detecting, and responding to future outbreaks.
Yeah, today being the World Field Epidemiology Day, I will advocate to all our levels, all the levels of government, to increase investment in health, to ensure that currently we have only just about a ratio of 1 advanced field epidemiology graduate to about 600,000 Nigerians, whereas the global standard is to have 1 to 200 people. So I think we need to increase investment across all these spheres so that we are better prepared as far as global health security is concerned.
We appreciate your time on the program. Many thanks for joining us. Dr. Jafi Abubakar is the Deputy Director, Head Epidemiology Division with the NCDC. Thanks again.
Thank you for having me.
Well, still to come on the program, Cross River to set up oxygen plants in Obudu local government area. We have that and more stories when we return. The Cross River State Government and other partners are set to construct an oxygen plant at the Obudu Specialist Hospital. The governor was speaking after an inspection tour of the hospital in Obudu local government area to a certain level of work done. According to the state governor, the establishment of the plant is in furtherance of the commitment of the state government to deploying effective response to the pandemic. The 140-bed capacity hospital will also, among other features, include a special COVID-19 special unit to provide swift support to patients.
I am shocked that even though I'm excited at the quality of work, I'm not too impressed with the speed. But of course, they have an inverse relationship. If you want so much speed, quality will be compromised. So here we are now compromising speed for quality. But I guess that in the next 2 months, they should be done with mortar and bricks so that we are convinced that our MRO, our CT scan, and all our radiology, our diagnostics, our different equipment for dialysis, world-class all cement. So I'm comfortable that we are going to have a first-class hospital with an oxygen plant. So we are producing our oxygen. We have a special COVID unit which will cater to COVID patients in a special way and support them with oxygen fully generated from within the system. We have a total of 120 beds plus an additional 20 for those who are going through the recovery phase. So a total of 140 bed hospital. Massive, 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 massive. And I'm quite excited that this hospital will be the reference hospital for Africa.
Away from Nigeria, Canada is now opening its borders to tourists who are fully vaccinated as of September 7th, 2021. Travelers will need to have completed the full course of vaccination. They must also be vaccinated with a Canada-approved vaccine. This means that travelers will need to have received 2 doses of either the Pfizer, the Moderna or the AstraZeneca vaccine, or 1 dose of the Janssen vaccine. Other vaccines that may be approved elsewhere in the world are currently not accepted. In addition, travelers need to have received their last dosage at least 14 days before they travel to Canada. Well, joining us for more on this, Dr. Momo Osezua, clinical research professional, Ontario, Canada, joins us now. Good to see you, Dr. Osezua. With this latest decision, would you say that Canada is better able to prevent outbreaks of COVID-19 infection?
Thank you, Millicent. The truth is, from the data we have so far, I think the government, I can possibly tell you that the government and the public health authorities, data shows that yes, we are able to contain, further spread of an outbreak, basically with this announcement coming in and taking effect from today.
Yes, do you really see incoming and fully vaccinated travelers without increasing the risk there is to health and safety of Canadians? Because even in these parts, we've also seen that after the tests and after vaccination, they've also caught on. And, there have been cases where people are said to have absconded. So, how are they going to check all of that and sort of stop, further spread?
So the measures that have been in place, if we look at the data, the measures that have been in place since February, there's been the compulsory testing at the airports or the points of entry or the border entry points. And then there's also been the issue of quarantining for at least 72 hours in government designated centers. Now that happened all the way from February to August. Now, if you look at the data from August, when the measures for quarantine was eased, that the 72-hour compulsory quarantine measure was eased in government designated facilities, we're also seeing that not much of the source of infection came from travelers. It was not from travelers. In fact, it's so low right now that I think last week's data only showed that 5 people were positive from almost thousands that came into the country. The data in August is already showing that it's less than 2% that is of the source of infection is coming from travelers or outside Canada because of these measures of border testing, coming in with fully vaccinated individuals, and also having your pre-boarding COVID-19 for at least 14 days, strong. 72 hours strong before you get on board on the flight. So those things have shown that really it's not, the source of infection has not been the traveling. So if we continue the measures of at the border of making sure that you get tested, so what we call surveillance testing, and right now the measures for 72-hour quarantine has ceased, but it's still mandatory that you do a 14-day quarantine after you have left the borders and you have got into the country. And with these measures, we think that the infection rates from travelers would not be a problem at all.
So let's look more within, and this is Canada. I mean, cases are still rising, but not as high as the beginning of the pandemic.
Yeah.
But has illness severity, hospitalization reduced with, the mass and rapid continued vaccination?
So from the data right now we have, especially in a province like Ontario, what we have seen is that there's a clear increase in the number of cases we've had over the past 3 weeks and probably the past 4 weeks, thereabout. But of course, by extension, we'll see that there's also an increase in the number of hospitalizations and what have you, the illnesses and hospitalizations, maybe even severity. However, what we are noticing is that they are still within manageable limits. Unlike what we had in April, when the health resources were stretched. People were taking double shifts and staying weeks, or there was just this massive outbreak within the healthcare space. So that is not so much of a problem right now. It's being managed, and the important thing we're also noticing is that this is manageable because of the vaccines. Because if you take a sample from what we have seen, 85% of those in the ICU, for example, are currently those that were not vaccinated. So the remaining 15% were actually from those who are taking the first shot or at least 2 doses. And then there are some that are just in the hospital and not in ICU. Same data applies, 75% and another 25%. So it's showing that with more vaccinations, we might actually not see severity of it. We might have cases, but it's not severe and it's not requiring any hospitalizations.
All right. Finally, Dr. Sezowa, with children going back to school in Canada, what are the approved vaccines for them?
Yeah, so for now, what we have is the Pfizer vaccine and the Moderna vaccines. Now, the AstraZeneca vaccines, as you mentioned, you listed out, I think there are about 5 currently on the for Health Canada. That's what's approved. The COVID Shield vaccine, that's one of the from Serum Institute of India. However, what we know now is that Moderna and Pfizer are currently what we have available for persons under 55 years. Now, AstraZeneca is also available, but it's only available for those above 55 years, and that's because of what has been in the media with regards to the clotting. So the health authorities here decided, so to avoid that risk, within that age group of less than 55, we're going to stick with just we're going to stick with Pfizer and Moderna for that age group, and anybody above that age group can have 3 of those vaccines. That's Pfizer, Moderna, and Pfizer, Moderna, and AstraZeneca. So that's what's happening now for Johnson & Johnson. We currently do not have that in wide scale for the public use. We also do not have COVID Shield, which is the Serum Institute of India SSI. We don't have that for public use, but they are approved in Canada. And of course, if you are traveling with those evidences, as you're fully vaccinated, you'll be allowed into the country. Currently, what is for public use is Moderna and Pfizer, like less than 55, and then the other 3 above 55. Yes.
All right. We always appreciate your time on the program. Continue to stay safe. Thank you so much, Dr. Momo Sezowa, clinical research professional, joining us from Ontario, Canada. Thanks.
Thank you. Thank you, Vincent. Bye.
And COVID-19 daily infections in Sydney fell for a straight day today, but still lingered near record levels as the outbreak spurred a spike in vaccination rates in the hard-hit western suburbs of Australia's largest city. Let's take a look at the global update.
COVID-19 daily infections in Sydney have fallen for a 3rd straight day, but still lingers near record levels as the outbreak spurred a spike in vaccination rates. Officials have promised residents in Sydney, the epicentre of Australia's worst coronavirus flare-up, more freedom once vaccinations reach first 70%, then 80%, as a lockdown now into its 11th week fails to quash the Delta variant.
Don't be left behind when we start opening up, because when we open up at 70% double dose, it will be only for those who are vaccinated. So there's time now to get your first dose and then fit in your second dose before New South Wales starts opening up. And I just want to make that message as strong as possible.
In neighbouring New Zealand, authorities are finalising arrangements to get more coronavirus vaccines as the country relaxes restrictions in all regions outside Auckland, its largest city. Authorities say schools, offices and businesses can reopen outside Auckland from Wednesday, but masks will remain compulsory in most public venues. Auckland will remain under hard lockdown for at least another week. The city of 2 million people is where the current outbreak began and has not yet been contained. In the Philippines, beauty salons, nail spas and other personal care centres in Manila will reopen on Wednesday after being closed for almost a month as the government relaxes lockdown restrictions. The move comes despite the Southeast Asian country reporting record infection numbers as it battles the Delta variant. Daily cases in the past 30 days alone accounted for more than a fifth of the country's total infections of over 2.1 million, while deaths have exceeded 34,000.
Remember that not everyone infected with COVID-19 shows symptoms. Remember to maintain a high index of suspicion and adhere to the preventive measures. You can visit our website for more updates, also a better understanding of the pandemic, several other breaking stories. It's channelstv.com. As a program this evening, thank you for watching. I'm Minister Ntwaka. Stay healthy.